Welcome back to the Urology Care Podcast. Our guest today is Elizabeth Timbrook Brown at MedStar Georgetown University Hospital in Washington, D.C. Dr. Brown, I want to start off today's discussion by asking you, what is a UTI?
So a UTI is a urinary tract infection, and that basically means that bacteria has gotten into the urine and travels up to the bladder, which can cause abnormal urinary symptoms. About 60% of women and 12% of men will actually have symptoms of at least one urinary tract infection during their lifetime.
And what defines a recurrent UTI? Because today's program is going to focus on recurrent UTI.
So we actually define recurrent UTIs as having at least 2 UTI episodes in a 6-month period or 3 within 1 year.
Can you tell us about some of the symptoms of a UTI?
So certainly different patients can present differently, but oftentimes most people complain of urinary urgency or frequency, blood in the urine, or new or worsening urinary incontinence. Most commonly people report burning as a definable symptom.
Can you tell us about some of the risk factors for getting a UTI?
So certainly the risk factors can change between sexes and within age groups, but one of the common reasons for urinary tract infections is having sexual intercourse, having high blood sugar, being postmenopausal. You can obtain urinary tract infections during pregnancy. You can get urinary tract infections if you have kidney stones.
Now, how common is it for a UTI to be recurrent, and what kind of is the definition of recurrent?
So again, recurrent UTIs are when we have multiple within a certain time span. So 2 within a 6-month period or 3 within a year. And approximately 20 to 40% of women will have actually another UTI or become recurrent. Men are actually less likely to get urinary tract infections in the first place, but if they do get one, they're more likely to have another because bacteria can dwell inside the prostate.
What advice do you have for patients on how to prevent UTIs?
So certainly one of the best things we recommend is drinking lots of fluids and staying well hydrated. Some recent studies have shown that in premenopausal women, we recommend drinking at least 1.5 liters of water per day. Also, certain birth control forms such as spermicidal foams and diaphragms are known to increase the risk of urinary tract infections. We certainly don't want to hold the urine. You want to urinate routinely throughout the day. Cranberry juice or cranberry tablets have been shown to prevent urinary tract infections. And then certainly in the postmenopausal setting, we do recommend using vaginal estrogen cream to decrease the frequency of UTIs. And then in the premenopausal setting, where UTIs are more common with sexual intercourse, we recommend sometimes a one-time antibiotic after intercourse, which can help with prevention of UTIs.
Now, other than the risk factors that you mentioned earlier, are there any other reasons why a patient would develop a UTI?
Oftentimes, patients do develop a urinary tract infection when they've been in the hospital because a catheter has been placed, so catheter-associated UTIs are very common, unfortunately. Other reasons can be if there's an anatomic abnormality, meaning something they were born with, such as children at an early age can be found to harbor bacteria in abnormalities called diverticuli, and actually older men can develop these as well due to enlarged prostates, or patients that have neurologic abnormalities often have urinary tract infections as well. Sometimes if you have a foreign body, such as a stent or a urinary tube, those patients can be at risk for infections as well.
What are some of the frequently asked questions that you get from patients in regards to UTIs?
Often, a lot of my patients ask about natural regimens that aren't necessarily FDA regulated, so I get a lot of questions about cranberry supplementation. Currently, we do recommend cranberry. It's not necessarily harmful to the patient. It doesn't really have any side effects, so I often tell patients that that's a very reasonable, natural way to help prevent infections. Of course, increased hydration is very helpful. We do know that vitamin C sometimes can be helpful, and I also get questions about D-mannose. Some of these things we have less evidence for, but again, if patients find it helpful, there aren't necessarily many harmful side effects to it, so I think those are all reasonable suggestions.
I want to ask you about the difference between a simple UTI and a complicated UTI. Is there anything you can tell us about that?
So typically we refer to a simple UTI as a urinary tract infection which has been commonly acquired in the community, such as after sexual intercourse. Typically these mean that they can be routinely treated as an outpatient with 3 days worth of antibiotics and typically are not associated with fevers, chills, nausea, or vomiting. When we think about complicated UTIs, that can often refer to more serious infections, such as infections going up to the kidney, where we do have fevers, chills, nausea, vomiting, flank pain. Other patients that may be qualified as complicated, so to speak, are patients who are immunocompromised or patients with diabetes. And then by definition, any man with a urinary tract infection is actually considered complicated since urinary tract infections are more rare. So typically when a man has a urinary tract infection, it does warrant a more invasive workup to try to figure out if there's something abnormal, such as an enlarged prostate where the urine's not emptying, or recurrent infections can be due to kidney stones or something to that effect.
Now, are there other final thoughts you want to leave us with before we wrap up today's interview?
I think one of the important things to know is that not all bacteria in the urine actually needs to be treated. So when there's bacteria that's found in the urine and patients don't have symptoms, that's called asymptomatic bacteriuria. And just because we find bacteria in the urine does not mean that patients need antibiotics. So only when patients have symptoms and bacteria is found in the urine do we recommend treatment. So again, if patients have urgency, frequency, burning, suprapubic pain, or blood in the urine, and bacteria is found in the urine, then we would recommend treatment. Of course, there are certain situations such as pregnancy where we do recommend treatment if there's bacteria in the urine, but this is why patients should always see their doctor and have a urine culture and have a discussion with them prior to taking antibiotics.
Our guest today has been Dr. Elizabeth Timbrook Brown. She is a urologist at MedStar Georgetown University Hospital in Washington, D.C. Thank you so much for joining us today.
This podcast has been brought to you by the Urology Care Foundation, the official foundation of the American Urological Association. For more information on today's topic and for all things urology health, visit urologyhealth.org. That's urologyhealth.org.